Hello, hi everyone. My name is Dr. Sana Khan, your biology expert, and you're watching our app that is InstaPrep. I hope you all are liking it. And if you are having any doubts, please try to write down in the comment section. So, in this video, we are going to cover the symptoms of malaria. What are we going to cover? Symptoms of malaria and preventative method. You might be wondering that ma'am is not going to do the life cycle. Ma'am has already done the life cycle in the previous video. So please go to the previous video, first watch the life cycle and then come to this video and study about the symptoms of malaria. It is one of the very important questions for your NEET exams as well as for your board. So now symptoms of malaria. So when you talk about malaria, what does it comes in your mind? Fever, correct? You might have got malaria before, yes or no? The ones who are watching the video, and you might have not got, but at least you must have heard about malarial fever, right? It's comparatively where you experience a lot of shiver, right? So now let us talk about the classical fever of malaria. So this classical fever of malaria is followed by sudden coldness. Okay, the person is going to start experiencing cold with lot of rigor, means lot of shivering. You're going to shiver. You're going to tell your mama that come on, give me 10 blankets, give me 5 blankets. I'm shivering. Okay, so it will be followed by sudden coldness, then rigor, and then you'll be having a high degree of temperature. Okay, so you'll be having a fever, and that fever is going to last for a certain period of time, and then you are going to have a sweating, a lot of profuse sweating. You'll feel tired after that, but still you will be better. Okay, so the malarial fever is very, very classical. It is followed by sudden coldness, followed by rigor, then fever where the temperature increases, and profuse sweating. Okay, so now the waves of the fever occur every 2 days in Plasmodium vivax and ovale, in every 3 days in Plasmodium malariae, and daily in Plasmodium falciparum. So this is an estimation that in every 2 days you're going to have fever in vivax and ovale, in every 3 days you're going to have in malaria, and daily you're going to have in falciparum. Okay, among which I've already told you that falciparum is a most severe infection when you get a falciparum infection. Plus, I have also told you when does the classical wave of fever arises, when the RBC is ruptured and the merozoite infect the fresh RBC. That is a time where you get lot of fever. Okay. So apart from fever, there are other symptoms also like arthralgia, that is joint pain, vomiting. Then due to hemolysis, that is due to the breakdown of RBC, you might experience anemia, that is decreased hemoglobin in your blood, hemoglobinuria, that is urine in the blood due to hemolysis. Hemolysis means breakdown of RBC, and in rare cases, you might have a retinal damage. That's only present only in the rare cases, and obviously when it doesn't get treated, it may lead to convulsions also. So severe malaria is mostly caused by Plasmodium falciparum, which occurs daily, which I've already told you. Apart from that, the person will also be having hepatomegaly, that is enlarged liver, splenomegaly, that is enlarged spleen. So hepatomegaly, that is enlarged liver, is also one of the symptoms, and splenomegaly, that is enlarged spleen, is also one of the symptoms. And the person may also experience hypoglycemia, that is decreased sugar level of the blood, severe headache, and in very rare cases, when there is an hemoglobinuria, the person may experience renal failure and cerebral ischemia. So these are few symptoms which occurs in very severe form of malaria. So now what are the preventative methods? This is something which you already know. That is, obviously you have to prevent the mosquito bite by using mosquito nets. You can use insect repellents like these. These are the various insect repellents which you can see it on the screen, which can be used to keep the mosquitoes away from us. Apart from that, spraying insecticide is also one of the good techniques to prevent malaria. And you have to see that there is no accumulation of water in nearby places, because those water contains mosquitoes which have laid the eggs. So draining stagnant water where mosquitoes lays the egg is very, very important. That is why mosquito and dengue, the mosquito-borne infection disease, or usually spread in rainy season much. Why? Because at that time there is an accumulation of water where they lay the eggs. And mosquito larvae can also be controlled by a release of Gambusia fish. By release of what? By release of Gambusia fish, because these Gambusia fish will eat up the larvae. So that is all about the preventative method, which I know you already know about it. There is nothing to learn over here. The only thing which you should know in this video is about the classical wave of fever. And one more thing is there is a substance called as hemozoin. Have you heard about it? Hemozoin, which is also released by this plasma. Okay, so that's all about malaria. We have covered entire thing. We have covered the life cycle. We have covered the causative agent. We have covered the symptoms and preventative methods. So that's all about this video, and I'll meet you soon with the next video. Till then, bye. Take care. I'll meet you soon.